Dementia. Most of us don't want to talk about it or even think about it. If we don't acknowledge it, then it's not happening, right? Wrong. We may have an image in our minds from the movies like The Notebook of someone in a long-term care facility with memory loss. Maybe you think it's a mental illness. But dementia is not a mental illness, and it's so much more than memory loss. Dementia is the result of damage to the brain cells. This damage interferes with the ability of the brain cells to communicate with each other. When brain cells cannot communicate normally, then thinking, behavior, and feelings can be affected. The subtle signs may have begun years ago, noticed only by those closest to the person experiencing them. It's normal aging, we said. Happens to all of us, we said. But at some point, dementia takes over our lives and can no longer be ignored. We are stressed and our loved one is confused, unhappy, and possibly angry. Perhaps if we had acknowledged that elephant in the room earlier, we might have had less stress and more joy in our life. At my continuing care retirement community, many residents have some form of memory loss, ranging from typical age-related all the way through to the final stages of dementia. When I moved to my continuing care retirement community over 3 years ago, I can honestly say that I wasn't clear about the difference between dementia and Alzheimer's, and I'm guessing that many of you aren't either. I became interested in dementia when I joined the Health and Wellness Committee here. I also joined the Cognitive Health Subcommittee. It was then that I started educating myself about dementia and became determined to educate others so that we could become a dementia-friendly community. Without question, there is a stigma associated with dementia, just as there once was with cancer. By bringing it out in the open and talking about it, everyone will benefit. Dementia is the umbrella term for memory loss and other thinking problems severe enough to interfere with daily life. It includes Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, others such as Huntington's disease, and mixed dementia, dementia from more than one cause. Dementia is a medical condition that affects the brain. Because it affects the brain, many people are not aware that their brain is changing. When others notice their strange behavior, they may shy away from them. This creates loneliness and isolation for both the person affected with dementia and their caregiver. Because of this, many people keep the diagnosis to themselves. However, being honest often brings understanding and compassion from others. I think most of us in our 70s are forgetful at times and may worry what that means. Am I getting dementia like my mother, or is it typical age-related changes? Let me show you a simple chart that may help clarify. With typical age-related changes, you may make a bad decision once in a while. But with Alzheimer's and dementia, there may be poor judgment and decision-making. With typical age-related changes, you might miss a monthly payment. But with Alzheimer's and dementia, you may be unable to manage a budget, write a check, or handle your finances. With typical age-related changes, you may forget which day it is, but remember it later. With Alzheimer's and dementia, you may lose track of the date, or the season, or the year. With typical age-related changes, you may sometimes forget which word to use. With Alzheimer's and dementia, you may have difficulty having a conversation. With typical age-related changes, you may lose things from time to time. With Alzheimer's and dementia, You may displace things and be unable to retrace your steps to find them. One of the strangest things that happens to people living with dementia is that their social skills are often the last to go. That means you could be sitting at the dinner table having a conversation with someone living with dementia and never know it. You may engage in an extended conversation and never have a clue that the person is living with dementia. Also, what you may not know is that the information they are giving you may not be accurate. Because dementia affects the brain chemistry long before the symptoms show, dementia often looks like nothing has changed, but in reality, everything has changed. With dementia, it can feel like the person is choosing to do things to hurt others or to make life more difficult. But it may be they simply can't get their brain to do the things it used to do so well. If I were to get dementia, how would I want to be treated? Here are 9 things I came up with that I would want others to know if I were living with dementia. My life with dementia. 9 things I need from you. Number 1, don't ask me if I remember something or someone. I probably won't, and it will just make me feel bad. Number 2, if I enjoyed listening to music, dancing, exercising, or visiting with friends, then help me to continue doing those things. Number 3, don't argue with me. Just agree with me. Say I'm sorry even if you don't mean it. It will save us both from feeling stressed. Number 4, I will probably mix up names, places, and events because my timeline is fluid now. Be patient with me. Number 5, join my reality even if it differs from your reality. If I think my father is still alive or we're going to visit my dead grandmother, let me believe these things. Number 6, if you don't know what to say to me, ask me about something that happened in the past, from my career, childhood, or school. Number 7, if I'm not acting logically, show me what you want me to do. Number 8, stop explaining. Instead, reassure or redirect me. Number 9, most of all, remember that I am still the person that you know and love. Please be patient and kind with me. If you need help, start with your primary care provider. Ask for a referral to your local memory care clinic or a neuropsychologist. You can also find a wealth of information from the Alzheimer's Association and the Dementia Society of America. Thanks for watching. Have a great day.